Well, this is me trying to get hold of my CMAR therapist to let them know that I will no longer be utilizing their services because I feel betrayed and that they're adding insult to injury by not telling the truth to the lawmakers about what's being done to injured workers here in Washington State and across America. Zero 0264.
Sorry, Celebration is not available. Record your message at the tone. When you are finished, hang up or press pound for more options.
I have no idea who that is, so I'm going to try and get a hold of her this other way. Hope I saw that correctly.
Thank you for calling CMAR. This call may be recorded for quality control and training purposes. For English, press 1 or remain on the line. Para español, oprima el... Thank you for calling up at How can I direct your call?
Yes, I was trying to leave a message with Catherine Barnes, and I'm also canceling tomorrow's appointment with her.
Okay, let me transfer you over to her extension, and you can leave that voice message, okay?
Okay.
Give me 1 second.
Okay.
You've reached Catherine Barnes. I'm unavailable at this time. If this is an emergency, please call 911 or the crisis phone at 1-800-584-3578. I am currently away from my desk right now. Please leave a message and I will get back to you at my earliest convenience. Thank you so much. Have a great day.
Record your message at the tone. When you are finished, hang up or press pound for more options.
Hi, Catherine. This is Darren Fonso, and I'm calling in regards to my health care with CMAR anymore. Whether I'm pretty much got to cancel it or DC it at this time because I feel that CMAR has failed me as a patient, and I feel that the CMAR's vice president or vice chairperson Claudia D. Alegre was able to have a Latinos a day at the Latino Legislative Day. She spoke at that, and they also was at that same day was supposed to have a work comp attorney talk about injured workers and what does it mean work comp mean for Latinos. Anyways, Claudia, your boss, apparently is able to spend 30 minutes talking about mental health that day, and also talking about a 30-minute session on talking with your legislators training. So Claudia D. Alegre knows how to get in contact with Senator Rick Larson and those type of people, and she knows how to get a hold of legislators and how to get a hold of that training. Yet CMAR isn't helping me to get the voice and the harm that was done to me. Yet CMAR helped me prove that harm to a state work comp judge and to a federal SSDI judge. Yet Seymour administration doesn't want to help me to get that same harm told to our state and federal lawmakers so that we could get the war on injured workers addressed with the minimum federal oversight my own liberal left told me we need. Yet, and Claudia Elger seems to have the ear of my liberal left, but she doesn't pass this harm and report this harm and abuse, harm done to me as an injured patient, onto our lawmakers so that this harm is not done to others as it was done to me. And the 400 injured farm workers I've also showed her about and told her about, that the Seattle Times or Seattle Post or whichever it was reported about 400 injured farm workers in our state, how work comp and labor and industries is failing them. And so now that's how I got to know what was going on. So I feel really failed. I feel I've had insult added to injury and betrayed. And how can I trust you guys with my health care anymore if Seymour administration doesn't want to get honest about what the mainline administrative folks on you guys on the front line help me to tell the truth to the other federal judge and a state judge. Yet we can't tell that truth and about that harm and report that abuse to patients that's going on for profit to Senator Rick Larsen or any of the other lawmakers as we're catering and kissing up to these people. I feel failed, ma'am, and that's not you. It is the administration, because my therapists were good for the most part, except for there was one back in the beginning, and I questioned what she had to say now. Her name was, what the hell was it, Elodia. Said, gee, Darren, you're like Mother Teresa trying to feed the babies, and you're never going to be able to feed all the babies. Well, of course I'm not, Elodia, and the other therapists that think that way. If you all stand in my way and block me from telling the truth, then yeah, Mother Teresa can't get the sandwiches to the babies because the administration from Seymour wants to block the truth from getting to the lawmakers and to the people so that we could get a war on injured workers addressed. So anyways, thank you and have a good day. And yeah, if you want to give me a call back, I'm at home at my home number. Thank you for your time. I would have loved to probably have worked with you, but Seymour administration seems to fail me, and I can't trust you guys to be my health care providers if the Seymour administration can't tell the truth to America and to our lawmakers about the war on injured workers. Have a great life, brother, sister. Have a good one. Thank you.
To send this message, press pound or hang up. To play it, your message has been sent. If you would like to try an extension, you may do so now. Goodbye.
Okay, that's that, and that's what I'm going to call. You know, they may give me some more calls, but I'm not doing anything violent. I'm just saying you are no longer going to be my care providers if you cannot, administration can't get honest about a war that was waged on me and my family and my father-in-law and 400 injured farm workers that I have educated these people about. So the administration wants to snicker and laugh as I'm getting in trouble from Bernie crowds and other political lawmaker types trying to get our voices heard and my voice heard, and they know that I'm trying to get our voices heard and the truth told about what Sanders says needs to be done on the table, but yet they can't help me get that truth told to the liberal lawmakers as they have those liberal lawmakers' ears. There's something not right with that, and that means my health care has now become a tool for which to help keep me held down and at bay and oppressed from getting the truth told to all the others. And that's what injured workers run into. And that you can't win even when you win. I'm documenting everything. Document. That's all I can say.